Are you experiencing joint pain while taking prednisone or after stopping taking prednisone? If so, you're not alone. This is a question I get asked all the time. And in this video, I'm going to explain why prednisone causes joint pain, what you can do about it, share a story of a prednisone warrior experiencing it, answer her specific questions, and exactly how to deal with this side effect. So first, I want to share the story of a prednisone warrior. She said, "Dear Dr. Megan, my doctor has done good with extremely slowly tapering my prednisone. From 2021 August, I was hospitalized with IV 100 milligram plus to now for giant cell arteritis." That's her diagnosis. This year, I am at 1 milligram of prednisone daily. I'm having both shoulder pains, hips, some pain, weak legs, which allow me to stand for about 30 minutes. I feel better than last year with Nutrinize. This is the supplement I invented for people on prednisone. I've been doing a little exercise of weighted machinery for arms, legs, and back. Also, I occasionally have 30-minute total body K2 stretch by a professional. I must confess, my exercise is minimal because of the pain. I'm in pain at home. Tapering off prednisone, my body has not handled well. First question. Are the present symptoms side effects? Will pushing myself to the gym more often while enduring these pains help to rid the pain? So that was the second question. I watch all your YouTube about pain and side effects. I think I should not be having this pain, though I will push to get off. You talk about the importance of exercise, but only since taking Nutrinize this year have I felt like exercise. Yes, 3 years too sick to exercise. I'm taking your Berberine for 1 month. I eat 2 meals daily and need to know if it will be safe at my largest meal to take 2 capsules to meet 3 daily. So that's her third question. Without much exercise, I need a full daily dose of Berberine to assist with weight loss. Thank you for helping millions of people. Prednisone warrior Barbara. Okay, so her 3 questions. Basically, the first one is, are the present symptoms side effects? And I would say they are not side effects. They are symptoms of prednisone withdrawal. And the reason I say that is because of this scientific article published in Clinical Advisor. This is where doctors and prescribers can advise each other, answer each other's questions. So the first doctor, ARNP, I think a registered nurse practitioner, said, "Why would high-dose short-term steroids cause pain, joint pain, or burning paresthesias during or shortly after the treatment course? What can be done to prevent or alleviate steroid-related pain?" And the answer from a doctor of nurse practitioner said, "A variety of steroid withdrawal symptoms can be seen in patients." So he is directly saying this is withdrawal. Like, he's not even saying, hey, he's directly saying this is withdrawal. "These symptoms include, but are not limited to, arthralgias," that means joint pain; malaise, that means feeling yucky; fever; anorexia, not eating; nausea, weakness, weight loss; lethargy, exhausted; hypotension, low blood pressure; abdominal pain; hyponatremia, low sodium; hyperkalemia, high potassium; and vomiting. There are several theories in the literature regarding the mechanism and etiology of steroid withdrawal syndrome. One theory attributes the symptoms to adaptive increased tissue demand for steroids that develops while they are being used. Another suggests the symptoms are a response to the relative increase in prostaglandin after the steroid is stopped. Yet a third theory describes suppression of interleukin and tumor necrosis factor following steroid withdrawal as the cause. One possible way to prevent or treat the symptoms is to reintroduce the steroid if the patient is developing withdrawal symptoms and proceed with a slower tapering. Telling someone who's taken 3 years to taper off prednisone and is proudly on 1 milligram a day that the best way to deal with their problems is to increase the dose is almost like a slap in the face. Like, that is the most depressing, painful answer to this question. Hey, I know you've worked hard for 3 years to get down, but time to go back up. That's the answer, is these are symptoms of prednisone withdrawal, and they're not sure what exactly causes it, whether it's the prednisone was suppressing these signals, whether it's TNF or prostaglandins or whatever, and prednisone was blocking them, and now they're like erupting and causing you pain, or what. They don't know really what causes it. All we know is the solution, which is your body is saying, I need more. You're not ready. Your body's not ready for you to go off of it. It's not adrenal insufficiency, it's prednisone withdrawal syndrome. Withdrawal is real. This is a chemical thing. People who are addicted to opioids or benzos, they go into withdrawal. People who have alcohol addiction have to go to the hospital to go through withdrawal. It's a real medical thing. It's not in your head, it's real. And unfortunately for prednisone, the treatment is going back on it. You are dependent. I wouldn't say you're addicted. Your body is dependent on this chemical to not have pain. So her second question is, will pushing myself to the gym help rid myself of these pains? No, it won't. The only thing that's going to help is going back on a higher dose. But one thing I discovered is that possibly she doesn't actually have withdrawal. Most likely for the general person who has taken prednisone, what I just said is totally true. But for her, one of the facts she dropped at the beginning was she's been taking prednisone for a disease called giant cell arteritis. I'm going to call it GCA for now. And people who have GCA are much more likely to either have this disease coexisting or have one disease lead to another. And that other disease is called polymyalgia rheumatica, or PMR. So she's most likely either going through withdrawal or now experiencing polymyalgia symptoms, which are shoulder pain and hip pain. The inability to lift a cup to your mouth. For a woman, the inability to latch your own bra. These are life altering because now someone else has to dress you. Someone else has to feed you. This is not a life that you want to live. So which is worse, not treating the disease or dealing with the side effects? It's a tough choice. But for me, I'd personally want my independence, my ability to feed myself and dress myself. So in that case, going back up on prednisone doesn't mean going to 5 milligrams. If she actually has PMR, which she can only find out if she goes to a doctor, gets diagnosed, they test blood samples, including ESR and CRP, which are inflammatory markers, to see if that's actually what's going on with her. And if it is, then going back on prednisone at a dose of at least 15 milligrams, if not up to 25 milligrams, is where she needs to go. Starting somewhere around there and then tapering over a year or longer. That is like the worst news I can share with someone. But really, you need to go to the doctor and find out the answer to this question. So finally, her last question is Berberine. She said she's been taking Berberine for a month and wondering how to increase her dose. So what is Berberine? Berberine is an ingredient I included in Nutrinized Zone, which is a supplement designed specifically for people on prednisone. And in it, I included a small dose so that this is safe for most people on prednisone because Berberine is metabolized in the liver. I didn't want it to be harmful for people with liver problems. But a higher dose of Berberine is great for people who are having metabolism issues. If you have high blood sugar, high blood pressure, high cholesterol, weight gain, Berberine is almost the perfect herbal remedy for you while taking prednisone because it works naturally, Mother Nature, in the exact way that prednisone is harming you. And so if you give it, it's giving you exactly what you need. So how do you take it? So it's up to 1,500 milligrams a day, and she's already got it. I've got it available on my website, Berberine, and she wants to know how to take the third dose. So you normally would take it one with each meal, but she only eats 2 meals a day. So in that case, you take that third capsule with your biggest meal of the day. So if she eats a small breakfast and a big lunch, take 2 at lunch and 1 at breakfast. If you take a big breakfast and small lunch, then take 2 at breakfast and 1 at lunch. And that supports your metabolism while on prednisone to help you get through this really tough time you're going through. So I love questions like this. If you'd like to know where you can find Nutrinize, you can click the link below to buy it now. Signing off as Dr. Megan, your prednisone pharmacist.